Hello, I'm Khalilah Fairus, and today I will be talking about SLE, which stands for Systemic Lupus Erythematosus, better known as lupus. Lupus is a chronic autoimmune disease in which the body's immune system attacks its own tissues and organs. The reason why I chose to speak about this topic is because, as a lupus fighter myself, I would like to spread awareness about this disease and for people who might have heard about it, for them to better understand what it actually is. So what is lupus? Lupus is a complex autoimmune disorder. The body's immune system attacks its own tissues and organs such as kidney, blood, joints, skin, brain, heart, and lungs. It's different for every patient. For example, my lupus attacks my kidneys and also my skin. To this day, the cause for lupus is still unknown, a mystery, but hormonal and genetic factors could be a trigger to lupus. Estrogen is known to have higher immune reactivity in women, and it can contribute to triggering autoimmune disease such as SLE. That is why 80 to 90% of lupus patients are women and are around the ages of 14 to 44 years old. Genetic factors could be that in the family history there are already family members with lupus, so it is inherited. There are 4 different types of lupus, the most common one being SLE. Most SLE patients are also diagnosed with lupus kidney disease, called lupus nephritis. The second is the cutaneous lupus, which is a skin disease in lupus. The third is the drug-induced lupus. And lastly, neonatal lupus. This affects the newborns of women with lupus. These are the common symptoms of lupus when the disease is active. Lupus patients would have a butterfly-shaped rash on their faces as shown in the image in the slide. Lupus patients will also suffer with joint pain anywhere around the body. They would also suffer from hair loss and they would constantly feel fatigue. Lupus patients are mostly photosensitive. Early signs of lupus could also be unknown bruises around the body, high fever, and also red rashes anywhere around the body. There are currently no cure to lupus. The treatments for lupus patients are mostly treatments that consist of immunosuppressant. These are the common medications taken by the lupus patients on a daily basis. Prednisone, which is the corticosteroids, and also hydroxychloroquine, which is an anti-malarial agent. I would say that these 2 medicines are the main medicine when it comes to treating lupus patients because it's the 2 medicines that I've been prescribed to take on a daily basis ever since I was first diagnosed with lupus 10 years ago. Azathioprine is a common immunosuppressive drug when it comes to treating lupus. The reason why an immunosuppressive drug is prescribed, it is to reduce the intake of the corticosteroids and also provide additional suppression of the autoimmune responses. Mycophenolate mofetil has been very effective in treating lupus nephritis. That is why it is one of the most common medicines taken by SLE patients. It is advised for people with lupus to protect themselves from UV light as it can trigger the disease to flare up. Stress could also be a factor in triggering the activity of the disease. Proper diet is also recommended to reduce the possibility of the disease being active and worsen. These treatments mainly help with minimizing the flare-ups of the disease in order for the patients to have a better quality of life. Even though lupus could be fatal, most lupus patients are expected to have a normal lifespan with the help of proper treatments. If you are interested in knowing more about lupus, I recommend going to the website lupus.org. Thank you for your time.